sciencecorner.net. I will start working on that website again soon, but I'm doing lots of other websites at the moment and lots of other projects, but it's on my to-do list. Really, it is on my to-do list now. The events of the last period in London, I'll cover some of them just as they affect myself and Speaker's Corner. And then I'll also talk about some wider issues. In particular, I've been doing research on the pandemic, on viruses and man and animals. I think I did part of that in the previous show. But I've gone into a little more depth now on China, because obviously everyone thinks this whole story relates back to China. And so I wanted to investigate why China carried out the lockdown the way it did, why events in China unfolded as they did, and what the consequences were, both at the time of the lockdown and afterwards, and, if you like, for the rest of the world. And then there's another question that I've been looking into in some depth recently, and that is the role of masks and the use of masks in everyday settings, which I have very strong grounds for believing is causing, or better said, did cause, the large spike in infections and deaths between November and February, and not even now. And I think a significant number, I think the evidence is probably there as well, that a very significant number of the people who died in the most recent outbreak died because they wore masks. Now, I know that's going to sound extremely controversial, and I'm going to try to show you why that is, why I put forward this idea, and why it's grounded in science. The idea that wearing masks in public is healthy was put forward really as a consequence of observing what was happening in Southeast Asia. A lot of people had the view that in Southeast Asia or in East Asia that people wear masks and they prevent themselves from getting ill, and that somehow helped hinder the development of the epidemic in South Korea, in Taiwan, in China, and in Singapore, etc., where the numbers, despite not having a lockdown, for example, in Hong Kong, Taiwan, and Japan and Korea, somehow the numbers didn't rise. So a lot of people attributed that to wearing masks. In fact, the masks are vectors of transmission, and this was known from the beginning. It was known, for example, on the 2nd of March 2020, Jenny Harris, the Deputy Chief Medical Officer for England, made a statement on television, it's widely reported in the media as well, that masks can actually increase your risk of getting an infection from a coronavirus. The very simple reason, and I'll visually show it for those of you watching on YouTube. So, for example, I don't have a mask on me, but if you have a mask here, let's say it's hanging from your ears underneath your chin, and you'll see that everywhere you go. And it means that you've worn it already. You've had it on your face, you've taken it off your face, off your mouth and nose, put it under your chin, and there it hangs like this. So if someone goes past you, and it was always the case that I thought, you can't catch it in the open air, but I think actually with a mask you can catch coronavirus in the open air, for the very simple reason that if you have a mask under your mouth and then you pick it back up over your mouth, you can have it infected and breathe it in for 10-20 minutes. The consequence of that is that you will become infected from the mask. Now, the only way around that is only to use a mask once, and that literally means once. So if you go into a shop like this shop here, for example, you're not really going inside anyway, you put on a new mask, and that would be a surgical mask, over your face, press it on, and actually you'd have to wash your hands beforehand. Then when you leave that shop, you take it off from the ear, fold it the other way around, and then you see there's one. You fold it the other way around, and then you dispose of it, and then you wash your hands again. And if you do not carry out that procedure, which is the medical procedure required to wear personal protective equipment like a surgical mask, then you are endangering your health. And in France, a few weeks ago, they banned all face masks that are made of cloth or not a surgical quality. They did this for the very simple reason it takes about 10 to 20 minutes for you, when you're wearing a face mask, that is a cloth mask, to make it damp. And when it becomes damp, it not only does not stop droplets from entering, it actually encourages them, because it will spread out. The liquid will spread around the. If a droplet falls on you from a passing runner or something, who coughs or breathes out heavily onto you or sneezes or something like that, the particles will land on the outside, like that guy there, land on the outside of the cover, and then you'll start breathing that liquid into your lungs. And because you're covering your face for a long period of time, there are large numbers of people now who are wearing masks. Pretty much, it's almost like a religious talisman. And so they walk around with these masks on, and the consequence is that as they get damp, they breathe it in for long periods of time. So whereas normally, if you were not wearing a mask at all, you could not then become infected, what's happening is I'm pretty certain, and the evidence has always been there, that this increases the risk of infection. Now, it would be a minor thing if it was only a small number of people, for example, care home staff or hospital staff, or people directly associated with, temporary entrance into very heavily dense populated buildings. You could even argue on transport. I mean, I'm not opposed to that. In fact, I argued that myself for many months at the very beginning of the epidemic in Britain. But once you've got millions of people wearing these, and there was a study done, it was reported on YouGov, that only 13% of those who use reusable masks wash them every day. And in fact, they should be washing them every time they use them. In other words, every few minutes, whenever they put the thing up and down. And of those who wear disposable masks, which is what, of course, the only mask you should possibly be using, of those who use disposable masks, 59% use the same mask many times. So, in actual fact, out of the total of mask users, only 25% of people use the mask correctly, which means 75% are increasing their risk of getting disease from using masks. Now, that's a disaster. And it's the type of disaster that we've seen happen right throughout this pandemic. In other words, the government initially doesn't know what it's doing. For example, they didn't have PPE for medical staff. You remember in February, March 2020, a year ago, they had no PPE for the medical staff. And the consequence was that some doctors and some senior consultants and so on were ordering staff to go to work with COVID patients without masks on. The hospital became major vectors of transmission. Between Oxford Centre for Medical Evidence-Based Medicine says around 20% of infections happen inside hospitals. Then you had the care homes, where they kicked the people into the care homes, about 25,000 deaths caused by that. Then you had collateral damage, because people were too scared to go to hospital in case they got infected. Quite rightly, they thought they might get infected in hospital. And then you had the madness that in June or July the government said everyone should wear a mask in certain settings, and eventually the public got in their mind, because they knew the government was being dishonest with them throughout the whole crisis. They got it in their minds that wearing a mask is somehow going to protect them. So everywhere you look, I literally can see people, everyone around me that I can see now. I've got 1, 2, 3 people I can see, and another one behind me, another one on the market stall, another one walking down the road here. All of them are wearing masks incorrectly and in ways that will increase their risk of catching coronavirus. And the French government banned these masks only last month, precisely because they are increasing the risk of catching disease. Now, this is not only coronavirus it increases the risk of, it could increase the risk of bacterial and viral infections of all sorts. Put it in context, I was studying about viruses in the last few weeks, and I found a very simple figure. You can rhinoviruses, for example. There's one of the smallest viruses, though, but you can fit 500 million of them on a pinhead. And so the idea that these masks are protecting you in any way from inhaling. Now, I know people say to you, "Oh no, it's not about protecting you; it's about protecting others." But of course, you can't protect others if you yourself become infected. And so, this is not a serious argument against someone else here in the shop, and they've been ordered. For example, this is Notting Hill. This is Portobello Road Market. The workers on the market stalls have been ordered by totally ignorant council officers to put masks on in the open air. And this, of course, hinders not only their ability to breathe and to function normally, but it also, as I said, increases the risk of them catching coronavirus. So that's one aspect. So I made a website in the last few days called unmask.org.uk, where I'm providing the detailed, or better said, the key evidence required to understand how this latest disaster has happened. And I would like to see a proper study done of the number of people who died in the last few months in hospitals, how many of them were wearing masks religiously. And I think you'll find that the overwhelming majority of them were wearing masks, and probably a significant percentage caught it from those masks. Now, I said I'd talk about China for a bit. So what I wanted to say about China is the following. Firstly, I discovered that Zhongnan Shan, and he's the lead epidemiologist and the lead fighter against SARS in 2003 to 4, and in 2020, and he ran the campaign, the SARS anti-SARS campaign, if you like, the lockdown. All that was pretty much his decision. Obviously in conjunction with the Communist Party, because he's a Communist Party member, head of the China Medical Association and so on. So it's not a non-political decision. But he was granted some autonomy to make these decisions. Because the government likes to create, in Western capitalism, you've got most of the countries are supposedly democratic, although we ask that question now a bit differently. But in China, and so you can remove one party in theory and elect another, and therefore you can allow debate and discussion. Whereas in China, there's only one party, so if debate and discussion takes place, it has to be inside the party. Otherwise, if it's in the open, then of course there isn't an alternative party to elect. So, in any case, Zhongnan Shan, he is a kind of a hero in China, and so what he did was he made a study of the number of children in Guangzhou, that's the town that faces Hong Kong, who have got antibodies to SARS, the original virus SARS-1, which is very, very similar to the present coronavirus SARS-CoV-2. And he found that 20% of children in Guangzhou born after 2005, whose blood samples were taken in 2010 to 2012, had antibodies to SARS. Now that can only be explicable by the fact that SARS never went away. And therefore what we may well be, I'm not guaranteeing this, what we may well be dealing with is various types of mutation from SARS, the original SARS, that have morphed into what we have now. Now, which would also mean that SARS has been circulating not only in China but all around the world at least since 2001. And I say 2001 because blood samples were taken in Beijing from children at hospitals in 2001, and they found 40% had antibodies. In other words, there had been a generalized epidemic that had affected huge numbers of children and probably therefore been transmitted through the generations into households in 2001, and maybe that was considerably earlier than that. These viruses have been around for millennia or millions of years. Bats and birds both host coronaviruses that have been around for at least 10 million years. Now, a recent study showed, just because I see a dog in front of me, a recent study showed that around 50% of cats and dogs can catch coronavirus as well. Cats in particular, in households where people have had coronavirus, CoV-2, they have a very high seroprevalence rate. And it's reckoned if you counted the asymptomatic transmissions amongst these cats, then it would be around 50%, and dogs 20 to 30%. Now, coming back to China, Zhongnan Shan, you see, he works as a lung doctor in his normal profession in Guangzhou, and what he said is that SARS still exists. It appeared to be a less virulent form. Now the problem is detection in China in the last period is not so great, and a very simple reason for this. The detection of respiratory illnesses in China, it is monitored, but the hospital levels are very poor. Most hospitals, you've got big cities, they might have very good hospitals, but then you'll have cities, which are lower level cities. So not the most big, not multi-million cities, but a city of 1 million, city of 2 million, city of 500,000, city of 300,000. And their hospitals are much far poorer quality. And you've got villages, townships, where, the villages, don't forget, 60% of the population or thereabouts still in some way have half their food. A lot of the people counted as urban now live on the outskirts of towns that have just been expanded as a geographical entity, but actually they're still villages. So between, let's say, 50 to 60% of the population still live in the countryside. So their medical facilities are extremely poor. If you turn up to hospital with a respiratory illness in a tertiary level hospital in China, in a village or a town or a lower level city, you will not receive the type of treatment that you would receive in a major city. Plus, there is medical insurance in China. It's a generalized medical insurance, been introduced in the last 10 years or so. And during this period, when they tried to move towards a national health service, in the inverted commas, the insurance level was only 50 yuan a year. 50 yuan is about 10 pounds a year. Now, obviously the pound goes a bit further, yuan goes a bit further than the pound, but not that much further. So for example, if you need cancer treatment and you go to hospital in China, the doctor will look at you and they will figure out, they'll work out how much money you've got. And treatment above that 50 yuan is dependent upon having money, and therefore if you cannot afford radiation therapy, you won't get it. And they'll look at you and they'll say, well, look at your finances, and they'll say, look, this is the treatment you require, and they won't even include the more expensive treatments. So it's not like the National Health Service in Britain. Now, the consequence of that is that most people cannot afford adequate medical treatment in China. And anger over this inequality in healthcare, because obviously the billionaires and millionaires can go to private hospitals, can jet out and see doctors all around the world. And this inequality in healthcare in China is one of the reasons why there have been massive numbers of protests in China over the last 20 years, and they keep escalating up more and more and more. They did until this year, or last year, escalating more and more and more about medical malpractice, medical mistreatment, and compensation. So if you go to hospital, for example, with your child, and your child becomes more sick or doesn't recover properly or requires expensive treatment, but you can't afford that treatment. So for example, there was a case I read about yesterday where a woman gave birth to, she had a car accident and gave birth to a premature baby. After the car accident, the baby was 26 weeks, born at 26 weeks, and so required a lot of treatment in the hospital in order to survive. And the parents couldn't afford to pay for that treatment that the child had received, and therefore they said, well, we're not, the child's not going to leave the hospital because we can't afford to take the child. So the child remain in the hospital, and then the parents will protest. Or if someone dies and, the doctor might have been taking bribes, you can have to bribe to get into a queue to go and see a doctor in China. They have people who professionally sell the position in the queue. And if you've got, let's say, a cancer treatment hospital, and people have to come from a long way away to go to the cancer treatment hospital, they'll go and queue up, and all the positions are paid for. And so enormous discontent had been developing for the best part of 20 years about medical inequality in China. And it's the one issue, it's death. You see, Chinese, they don't actually have religion. In history, and I can say this from my own family background, the Chinese historically, they were ancestor worshippers. They worshipped their family, and the family was defined by the family name. So in my case, it's Khoo is a Chiu is called, and Chiu is a clan name. And in my father's house, for example, they still have the tablet, and the tablet lists, like, I think it's 24 generations of the clan. So you go backwards in time, and each generation gets a generation name. So the generation name is in the middle name. Now, and you're worshipping, when you worship the dead, you're worshipping, if you like, the bones of the people going through the continuity through your line, through your bloodline, or your agnatic line, as they call it, through the bones. Yeah? Now, therefore, life and death are big cycles in China. Often the greatest upheavals in China happen around the death of a leader, for example, Mao Zedong, Zhou Enlai, Deng Xiaoping. And the consequence of that is that if someone dies in hospital and they didn't receive the proper treatment, they felt they were forced to stand in queues, they had to bribe the doctor, the doctor took a bribe from someone else, and violence and conflicts in hospitals in China are ubiquitous. And there's even a name for it. It's called Yinnao, and Yinnao refers to these conflicts that happen in China in the hospitals. Now, the government, its prime concern is to maintain social stability, precisely for this reason, that they do not have a democratic governmental system. They only have democracy inside the Communist Party. So, because of that, there's no scope for error except to remove officials who are blamed by the people. And so generally the government has to react. National government has to react. Everyone's got video cameras like we have here and so on as well. So people will go and report about what's going on. But it's such a large-scale phenomena that it is also true that if, for example, you lose your brother dies in hospital, and you're blaming the doctor for not allowing them to have more expensive treatment or something like that, and then often the family has to take the body, but then they'll leave the body at the front of the hospital, and then they'll set up some sort of shrine, or they'll have a big banner that they put outside the hospital. And there are also people, and this shows you how ubiquitous it is, just the same as there are people who will stand in the queue on your behalf that you have to pay, there are people who will protest on your behalf. So putting up a banner might cost £10 for a day. Having 4 people go to the hospital and wail and scream, that costs about £50 a day. It's like that. And so you got sort of rent a protest that's associated with hospitals. Now, the reason why the government's scared of this is because the sense of injustice is very real, very palpable. And the consequence of that is that the Chinese state and Communist Party feared that when the SARS-2 epidemic appeared to be breaking out, now, as I said earlier on, I think the SARS epidemic was actually probably at its end in China at that time, rather than at the time they detected it. It probably had circulated quite widely wherever in China, and but that's a speculative theory. But I hope to provide some evidence for it at some stage. But more importantly, it was coming to an end in any case, because around 5 million people left Wuhan before the lockdown in China, the 10 days before the lockdown in the Chinese New Year 2020, and it didn't spread outside of Wuhan, and a little bit in Hubei, but not much. Nowhere else was there any major recorded deaths. And so either it was totally concealed, which of course is partly possible, or it simply did die out. And there's good reason for thinking that it did die out in that way, and that's because, at least in the detection level, and that's because it's a very young cohort. The migrant workers who return home during the holidays are generally tend to be very young and fit individuals, and the consequence of that is they're less likely to be, coming down with symptomatic SARS-CoV-2 and dying. Only about, a very small percentage, a very specific age cohort tend to die or become seriously ill with coronavirus. Now, so to recap that, what does it mean? It means Chinese government was faced with the potential, if a viral outbreak is serious, of massive social unrest. And it was for that reason that they felt the easiest way, or the most efficient way, to pacify this would be to lock down rapidly and try to prevent spread, and then try to serve, or if you like, rejiggle the welfare system in China and the health system in China to make it appear to be standing for the people. And that's why Zhong Nanshan again was chosen as the sort of medical Yuri Gagarin, the guy who went to space for the Russians and represented the future of Russia. Well, this was what Zhong Nanshan's role has been, or is what Zhong Nanshan's role has been, is to sort of represent the masses and their interests in medicine, and therefore in fighting inequality. And China has just announced, for example, they've got rid of poverty, like absolute poverty has been abolished in China. That's this year. That was one of their goals. So these dynamics, the internal dynamics of the Chinese system, led to this movement by layers of the Communist Party and the bureaucracy that administers society, including administering hospitals, schools, pension schemes, housing estates, and so on. This bureaucracy, lower levels of the bureaucracy and the lower levels of the party, they increased their power as a consequence of what happened during the lockdown. So it's quite different to what happened here. You see, what's happened here is, rather than, it would have happened here had the so-called lockdown worked and the whole thing been resolved and hardly anybody died. Well, then you might have argued that a 3-week lockdown or something like that, improved the solidarity of society, and the government played on all this type of thing, Captain Tom and all that sort of stuff. But now, a year on, with all this chaos and, so many people were said to be dead from COVID, care home deaths and now what I believe mass deaths. Well, the only thing that we know for sure is that people have been plundering the treasury. And they've been plundering the treasury to help their buddies, the case of Matt Hancock and stuff like that. So I didn't even get a chance to talk about, I was arrested this week, Piers was arrested this week, we've been harassed by police, Speaker's Corner, I was forced out by the police. You can check on YouTube. Time's running out, so this is a half-hour show, so that's going to be the show over. That was the Speaker's Corner show for this week. Tune in same time, same place next week, 104.4 Resonance FM, 3 o'clock on Wednesdays. And you can come down to Speaker's Corner any Sunday afternoon, and hopefully you won't be arrested. And see you again soon.